Have you been injured, seen a doctor, even had some imaging, and told that everything looks normal? Do you continue to suffer and don't know why? There are some common injuries that are missed, and in this series, we're going to discuss one of them, which is called a spinal facet joint injury. This is part one of a four-part series. Hi, my name is Dr. Matthew Collins. I'm a chiropractor. I'm board certified in rehabilitation and fellowship trained in primary spine care. In addition to my training, education, and experience, I've been managing patients with facet joint injuries for decades. What I'm about to share with you is not a replacement for standard medical or chiropractic advice, for diagnosis, or for treatment. Seeing the wrong provider can result in an incomplete diagnosis and, unfortunately, an incomplete or poor, sometimes even no recovery. In this four-part series, we're going to start with here, the first one, what is a normal joint and what is its normal function? In part two, we're going to discuss how is it injured. Part three, we're going to discuss treatment. And in part four, we're going to discuss what you can expect in terms of recovery. So let's jump in. So what is a normal facet joint? Well, joints are where two bone surfaces meet and they are held together with straps called ligaments. And in the spine, these joints are called facet joints. So you'll hear me use that term often. The joints provide normal ranges of motion and limits. So they're essentially a hinge. Now these joints are alive. They have cartilage, they have blood vessels, they have nerve endings, and they're held together with ligaments. And these other tissues can be damaged. Now, the North American Spine Society is a large organization that publishes research, publishes patient education material, and it's one of the largest groups for spine providers, mostly surgeons and non-surgical spine providers. According to their published summaries, the most common cause of persistent pain following a whiplash injury is the joint pain. The second most common, or one of the top common ones, is disc pain. Regrettably, both of them can occur together. Now, they address muscle pain. Muscles are rarely the primary cause of persistent pain following a whiplash injury. Now, muscles are painful, but they're secondary. Oftentimes, they're secondary to the facet joint injuries, or they are secondary to the disc injuries, or secondary to something else. So they are a pain generator, but they're rarely a common cause of pain. Now, joints provide range of motion. They provide smooth gliding motion so that you can turn effortlessly from side to side. The joints also provide protection. They also limit ranges of motion so that you can't move in every single direction. And these joints provide a very important structural component to the body. There's nerve endings. These joints are alive and they communicate to the brain with things called position sense, where your body is in space and time. They communicate how much strain, how much tension, how much stress is going through the joints and the tissues. Now, the spine is divided into four parts. The neck is called the cervical spine. The middle of the back, where there are ribs attached, is called thoracic. The low back is called lumbar. And then the last part that's in between the iliums of the pelvis is called the sacrum. So why are these missed? Well, it's tough to make sweeping generalizations for all of healthcare, but a very, very common reason is that a lot of the providers are just simply not trained to do it. Part of the standard curriculum in most medical and chiropractic colleges does not really stress trauma assessment or evaluation. So if you don't really know what you're looking for, you have a really hard time diagnosing it. So a trauma education is postgraduate, and this postgraduate education tells you what normal is, what abnormal is, and how to diagnose it. There's also things that go into the training is how to identify the injury mechanism. So certain injury mechanisms tend to favor different types of tissue injuries versus other injury mechanisms. So understanding that is important. Also understanding how the tissue injury presents. So somebody with a facet joint injury theoretically could present with a different symptom pattern than somebody who has, say, just a muscle injury. The physical exam is also important, knowing how to do a detailed physical exam. We see patients that come in all the time where they saw a provider never touched them, asked them a few questions, and sent them right off to imaging. And this is very, very problematic when it comes to facet joint injuries. Why is that? For the most part, facet joint injuries cannot be diagnosed on imaging. It's unfortunate, but that's just kind of the way that it works. Also, too, there's different grades or levels of severity of injury, and a lot of times providers don't know how to do that. Last but not least is experience. It's one thing to have the education. It's another thing to have the training. But if you're not on a day-to-day basis, as the years and even the decades go by, used to seeing these injuries, you can lose some of that. And so learning the subtle nuances of how these patients show up is also very important. So seeing a provider that has the postgraduate training, education, and the day-to-day real life experience is really, really important. So the most common thing that we see is that muscle pain tends to mimic what facet joint pain looks like. And because muscles are so close to the skin, it's one of the first tissues encountered if there is a physical exam that's done. And many times we see patients that come in where the muscle injuries were diagnosed and the provider that evaluated them stopped right there. So that kind of gives you, in a nutshell, a little bit about what a facet joint is like, what the facet joint function is like, and a little bit about the facet joint injury in and of itself. Thank you for taking the time to watch this. You have a lot of videos to pick from, and I'm honored that you chose mine. Thank you and have a blessed day.